Receive my greetings, my dear followers across the globe. It's my hope that you are fine and that God has kept you safe. I'm also fine and I'm grateful to God. Today is on Sunday, 6th of October, 2024. It's a very special day in the world because it is International Cerebral Palsy Day. International Cerebral Palsy Day. And therefore, because I give all the talks, I saw it good if I can also come live and share some insights about cerebral palsy. So I want us to learn what is cerebral palsy, what are the causes, what are the symptoms, what are the treatment options and the available preventive measures. So journey with me as I unfold the mystery of cerebral palsy. Welcome. So cerebral palsy refers to a group of permanent movement disorders that are primarily caused by damage to the developing brain. And this most often occurs before birth. I want you to underline the word permanent. Permanent movement disorders. This means they are irreversible. These disorders, these movement disorders are irreversible. Once they have occurred, and they can never be reversed. That's what we are calling cerebral palsy. So this group of movement disorders, they will affect the muscle tone, the ability of the muscles to contract. So the contractility of the muscles will be affected. The posture will be affected. The sitting posture, the standing, the walking posture will be affected. And also the motor skills, the ability to control movement, the ability to lift the arm, the ability to lift the leg. So these disorders will affect the motor skills. This child will have impaired motor skills. So the exact cause of cerebral palsy is idiopathic, meaning the exact cause is unknown. But we have certain factors that can be attributed to cerebral palsy. And these causes, these factors can happen before birth. These factors can cause cerebral palsy around the time of birth. And these factors can also cause cerebral palsy after birth. So we have prenatal causes before birth, perinatal around the time of birth, and also postnatal, that is after birth. So what are some of the prenatal before birth? What are some of the causes? We have what we call, we may have infections, yes. We can have cytomegalovirus infection. We can also have rubella infection, what we call the German measles. These are some of the infections that can predispose one to cerebral palsy. And that's where you get, those pregnant mothers should get the rubella vaccine. Another cause could be stroke. Yeah, stroke, maybe stroke to the mother. And also we have fetal stroke. This can also cause cerebral palsy. Stroke occurs whereby there is limited blood supply to the brain. Where there is low blood supply, we also have low oxygen supply. So stroke comes. In another term, it's called CVA, cerebrovascular accident. So stroke is a cause. Another factor could be what we call periventricular leukomalacia, and this is lack of oxygen to the brain. Yeah, lack of oxygen to the brain. Another factor could be maternal factors. Maybe the mother has some conditions like thyroid problems. The mother can have seizures. Yeah, these are some of the conditions that can predispose a mother to giving birth to a child with cerebral palsy. What about the perinatal? The causes that can occur, the factors that can cause cerebral palsy around the time of birth. One, we have premature birth. babies that are born prematurely, yeah, maybe the baby is born before the due dates. And also we have babies who are born with low birth weights, less than 1500 grams. That baby is at a higher risk of having cerebral palsy. Another factor could be asphyxia. Asphyxia is oxygen deprivation before birth, around the time of birth, or immediately after birth. The vital body organs like the brain lacks oxygen, and these can lead to cerebral palsy. So these are some of the factors that can occur around the time of birth. What about after birth? What can predispose a child to cerebral palsy? One of the factors is head injuries. Maybe during birth, the instruments that were used to deliver the baby, maybe there were some episiotomies. You know, when the mother is unable to push, or when the birth canal is not, the perineum is not loose enough, episiotomy can be done. Episiotomy can be done to enlarge the birth canal, the perineum, so that the baby can come out. So maybe the instruments that are used to do the episiotomy can injure the brain, can injure the head damage, and this can predispose a child to cerebral palsy. Another factor could be severe jaundice. Yeah, jaundice, that is yellow coloration of the baby. You know, we have what we call, have you seen babies who are born with, like, they are very yellow? You look at the eyes, they are yellow, the skin is yellow. So there is a problem with bilirubin. I will explain in details maybe later. So bilirubin, there is a problem with maybe the liver is unable to excrete bilirubin and conjugate, unconjugated bilirubin. So these are some of the factors that can cause the yellow coloration of the skin. So if this jaundice is not treated, it can damage the brain, and cerebral palsy can be a possible outcome. So another factor that can cause cerebral palsy after birth is infections. Infections like meningitis, encephalitis, these are some of the infections that can cause cerebral palsy. So I want you to understand that the causes can come before birth, around the time of birth, and even after birth. So I want you to note the causes, because the prevention of cerebral palsy will be dependent on these causes. So quickly, let's look at the symptoms. So what are some of the symptoms of a baby with cerebral palsy? You will notice babies with difficulty in swallowing or speaking. The baby has difficulties in swallowing food or speaking. Cerebral palsy will also manifest with unusual posture, maybe bending on one side, sitting in one side. So that is unusual posture. Another thing is what we call the delayed milestones, delayed developmental milestones. The baby has taken too long to start crawling, to start sitting, to start walking, to start moving. These are delayed milestones. Another symptom could be muscle stiffness, very stiff muscles, what we call hypotonia. The muscles are very hard, they cannot contract, yes. And also we have seizures, epileptic seizures. I know, you know what I mean by seizures, epilepsy. The baby is having convulsions. Yes, those are the seizures I'm talking about. And also the intellectual disabilities, vision problems, hearing problems. These are some of the symptoms of cerebral palsy. So I want you to understand that these are some of the symptoms that can manifest in a baby with cerebral palsy. I've said difficulty in swallowing, unusual posture, delayed milestones, muscle stiffness, and also intellectual disabilities, hearing problems, and vision problems as well. So these, I want you to note them so that